From a biomedical perspective, a lice infestation is a simple parasitic problem, insects feeding on human blood. In traditional Chinese medicine, however, we look past the bug to identify why the body's defensive qi, the wei qi, failed to prevent the colonization in the first place. Scalp health is maintained by four specific internal systems. Liver blood and kidney essence nourish the hair, spleen transport manages fluids, and lung wei qi provides the first line of defense. When these systems are out of balance, they create a hospitable terrain for lice to settle. It is vital to set clear clinical expectations. Acupuncture does not physically kill lice or manually remove nits from the hair. Because needles cannot physically clear the infestation, mechanical removal and strict environmental hygiene remain the non-negotiable first steps of treatment. Once the physical parasites are cleared, acupuncture becomes the primary tool for reducing inflammation, stopping the itch, and altering the internal terrain to prevent a second infestation. Identifying the internal root requires traditional diagnostic techniques, beginning with a precise pulse reading to determine the state of the patient's blood and heat. We evaluate four presentations. Damp heat presents with oily scalp, crusts, and greasy tongue. Blood deficiency manifests as dry scalp, thin hair, and pale tongue. Wind invasion features a sudden, migrating itch, while toxic heat causes pus formation and swollen lymph nodes. Because each pattern creates a different environment on the scalp, your choice of points depends entirely on which of these four imbalances is dominant. On the head, local points offer immediate relief. Du 20 improves circulation, and Taiyang calms itching. To treat the root, we use distal points. Li11 and SP10 clear heat, while ST36 and SP6 support immunity and moisture. Let's test your diagnostic intuition. A patient presents with a chronic mild itch, fatigue, a pale tongue, and dry hair. Based on these findings, which two distal points will you use? The correct points are spleen 10 to nourish the blood and stomach 36 to boost qi. These findings indicate a pattern of blood deficiency generating wind. Local points provide the patient with symptomatic comfort, but these distal selections are what actually resolve the internal vulnerability. Because lice predominantly affect school-age children, clinical efficiency is essential. Traditional needle retention is often difficult for young patients to maintain. In these cases, we utilize non-invasive alternatives. Techniques like Shonishin tapping, light acupressure, or laser acupuncture provide the necessary therapeutic stimulus without the use of needles. We also provide parents with home care protocols. This includes environmental cleaning and dietary adjustments, like removing greasy foods to help clear damp heat from the system. Adapting your clinical approach for children and enforcing these home protocols is the only way to move from temporary relief to long-term eradication. This represents the complete clinical protocol. Step 1 is mechanical removal and hygiene. Step 2, identifying the internal pattern through tongue, pulse, and scalp signs. Step 3, selecting points to treat symptoms and the root. Step 4, providing dietary and environmental advice for prevention. This clinical cheat sheet summarizes the four patterns and their treatment points. You should save this for reference in your practice. This data allows you to look past the superficial itch and address the underlying cause of chronic recurrence. Long-term resolution requires a focus on the parasite and the internal environment that let it thrive.